second class of anti-cancer drugs, that is cell cycle specific. Cell cycle specific. Carefully note, few drugs act on S phase specific, S phase, so these are S phase specific drugs, and few drugs on M phase, so these are M phase specific drugs. Forget about M phase specific drugs. First, S phase specific drugs. HAT classification. H for hydroxyurea, another H for histone deacetylase inhibitors. Okay, one H for hydroxyurea, another for histone deacetylase inhibitors. A for antimetabolites, and T for topoisomerase inhibitors. So S phase specific drug subclassification: hydroxyurea, histone deacetylase inhibitors, antimetabolites, and topoisomerase inhibitors. I am telling you, for your second crop MBBS, these two are very important: antimetabolites and topoisomerase inhibitors. First, I am coming to antimetabolites. There are three groups. One is antifolate. First is antifolate. Second is purine analogs. And third is pyrimidine analogs. These all three groups are antimetabolites, and this is very important, especially antifolates. And you have heard this name, methotrexate. Methotrexate. This is very important drug. Again, I am telling you, be ready to face question, short note, or explain why anything on methotrexate. This is very important drug. Okay, first important antifolate is methotrexate, and second pemetrexate. Remember these two antifolates. Second, purine analog. Remember these drugs: 6-mercaptopurine. In short, it is called 6-MP, 6-mercaptopurine. 6-thioguanine. In short, this is called 6-TG, 6-mercaptopurine, 6-thioguanine. Another important drugs are fludarabine, cladribine, and pentostatin. If you think this is tough, forget about this. At least remember 6-MP, 6-TG, fludarabine, and cladribine. These are purine analogs. And among pyrimidine analogs, very important drugs are 5-fluorouracil and capecitabine. Remember these two drugs, fluorouracil and capecitabine. If possible, you can also remember cytarabine, another important pyrimidine analogs. So these are antimetabolites, only antimetabolites. Okay. For antimetabolites, antifolates. Among antimetabolites, antifolates are most important. And in antifolates, methotrexate is most important, very important drug. So first, let's discuss mechanism of methotrexate. This is very, very important question. Dihydrofolic acid. Dihydrofolic acid is converted to tetrahydrofolic acid by one enzyme. Name of the enzyme is dihydrofolate reductase. And this is not new. All of you know this. Dihydrofolate is converted to tetrahydrofolate by this enzyme, dihydrofolate reductase. Methotrexate inhibit this enzyme. Methotrexate inhibit this enzyme. So what happened? Tetrahydrofolic acid. This is important for this tetrahydrofolic acid is important for synthesis of purine and thymidylate. Purine and thymidylate. And this purine and thymidylate are important for DNA and RNA synthesis. So if methotrexate blocks dihydrofolate reductase, they ultimately inhibit DNA and RNA synthesis. And another part is in tetrahydrofolic acid. This is the active form of folic acid. In tetrahydrofolic acid there is methyl group, and this tetrahydrofolic acid donates methyl group to one enzyme, that is TS, that is thymidylate synthetase. So tetrahydrofolic acid gives this methyl group to thymidylate synthetase, resulting in so now methyl group is present in thymidylate synthetase, and this compound, this enzyme with methyl group, thymidylate synthetase with methyl group, it converts DUMP to TMP. DUMP means deoxyuridine monophosphate. Deoxyuridine monophosphate, and TMP means thymidylate monophosphate. TMP means thymidylate monophosphate. And this TMP is involved in DNA synthesis. Okay, so ultimately methotrexate, when inhibits this enzyme, they directly inhibits dihydrofolate reductase enzyme, and ultimately indirectly inhibit this enzyme. Final result is inhibition of formation of DNA and RNA synthesis, and this is the mechanism of action of methotrexate. Okay. This is very important, and here you have to remember name of these two enzymes. What are they? Dihydrofolate reductase and thymidylate synthetase. Okay. So methotrexate main mechanism of action is inhibition of dihydrofolate reductase or dihydrofolate reductase inhibitor. At the same time, it is also thymidylate synthetase inhibitor. This is a mechanism of action of methotrexate. Second is indications. There are many indications of methotrexate. You know, you don't know the cancerous conditions, but you know the non-cancerous conditions. Mnemonics recipe, R for rheumatoid arthritis, all of you know. Okay. E for ectopic pregnancy. Here methotrexate is also used. C for choriocarcinoma. What is choriocarcinoma? Choriocarcinoma is a carcinoma of trophoblastic cells, usually seen in placenta. I. I for methotrexate is immunosuppressants used in graft versus host disease. Okay. Next, P. P means psoriatic arthritis. Psoriasis is a skin condition, from here arthritis may occur. So psoriatic arthritis. And E for excess dose of methotrexate is used in osteosarcoma. Osteosarcoma is a bone tumor. Okay. So these are the indications of methotrexate, and there are also other indications I will discuss. Before that, let's see the side effects. Very important, frequently asked question in Viva and theory. Remember, methotrexate is very important drug for your exam. Bone marrow suppression is most common side effect of methotrexate, and it is treated by giving leucovorin. Another name of leucovorin is folinic acid. Another name of this leucovorin or folinic acid is citrovoram factor. Remember this drug, leucovorin, bone marrow suppression is treated with leucovorin. Another side effect is crystals in urine, and this is treated with bicarbonate. And another side effect is hepatotoxicity. But frequently asked question in Viva, bone marrow suppression caused by methotrexate is treated by which compound? Answer is leucovorin or folinic acid. Okay. So I have discussed antifolate drugs. Now I will discuss purine analogs. Look here. Examples of purine analogs: 6-mercaptopurine or 6-MP, 6-TG, fludarabine, cladribine. These are purine analog. Okay. Till now I have finished antifolates, and before going to purine analog, I want to show you two MCQs. Read the question. All are non-neoplastic uses of methotrexate except non-neoplastic uses. Rheumatoid arthritis, non-neoplastic condition. Ectopic pregnancy, non-neoplastic condition. Graft versus host disease, non-neoplastic condition. So osteosarcoma is the answer because it is neoplastic condition. Next question, same. All are non-neoplastic uses of methotrexate except psoriasis, skin condition. Okay, this is not neoplastic condition. Here topically methotrexate is used. Wegener's granulomatosis. This is a blood vessel related disease. This is also non-neoplastic condition, so methotrexate is used. Crohn's disease is a disease of bowel. Here also methotrexate is used. Okay, and last is choriocarcinoma. This is neoplastic condition. This is neoplastic condition of trophoblastic cells. Okay, so psoriasis, all are non-neoplastic uses. Psoriasis non-neoplastic uses. Wegener's granulomatous non-neoplastic condition. Crohn's disease, in all three diseases methotrexate is used, but all three diseases are non-neoplastic condition. But choriocarcinoma is neoplastic, so answer is 4. I have discussed these two MCQs to show you few new indications of methotrexate. And apart from methotrexate, you can see here there is another drug, pemetrexate. This is not important, but I want to tell you one line. Pemetrexate, like methotrexate, pemetrexate does not inhibit dihydrofolate reductase enzyme. Okay, pemetrexate does not inhibit this enzyme. Pemetrexate inhibit thymidylate synthetase enzyme inhibitor. Okay, and side effect of pemetrexate is just like methotrexate. Bone marrow suppression is the most important side effect of pemetrexate. Even bone marrow suppression is seen more with pemetrexate compared to methotrexate. Treatment here, in methotrexate induced bone marrow suppression treatment was leucovorin, and in pemetrexate induced bone marrow suppression treatment is leucovorin plus vitamin B12. Okay. Next, antifolate finished. Now purine analog. Okay, and then I will go to pyrimidine analog. First, purine analog. Purine analog, look at the drugs: 6-mercaptopurine, 6-thioguanine, fludarabine, cladribine. Okay. Purine analog, mechanism of action. Purine analog. These drugs, purine analogs, are converted to triphosphate intermediate metabolites, triphosphate, and then this triphosphate is incorporated in DNA and causes DNA damage. Also, these purine analogs inhibit purine synthesis, de novo purine synthesis. Purine analogs, these are the two mechanism of actions of purine analogs. Okay, before going to pyrimidine analog, I want to tell you one line. Here you can see one drug, cladribine. This drug is drug of choice for one disease, that is hairy cell leukemia. Important MCQ. Cladribine is drug of choice for hairy cell leukemia. Now I am going to pyrimidine analog. 5-FU, 5-fluorouracil, capecitabine. These are two very important drugs, pyrimidine analogs. 5-FU, simply remember 5-FU inhibits this enzyme, thymidylate synthetase. Forget about this. Anyways, and capecitabine, next drug, capecitabine. This drug is nothing but prodrug of 5-FU. Okay, so 5-FU inhibits thymidylate synthesis. This is the mechanism of action. And second drug, capecitabine of pyrimidine analog. This drug is prodrug of 5-FU. And forget about this mechanism of action. This is not important. Remember these two drugs, and I want to tell you one very important side effect of these two drugs, 5-FU and capecitabine. Remember, this is unique side effect. Hand-foot syndrome. Very common MCQ. Hand-foot syndrome is caused by 5-fluorouracil and capecitabine. Okay. Next, so I have finished antifolates, pyrimidine analogs, purine analogs. S phase specific drugs. I am discussing S phase specific drugs. First one was antimetabolites, and I have finished antimetabolites. Now, second group is hydroxyurea, and third group is histone deacetylase inhibitors. I will discuss this, but this is not important. These two groups start with H. These are not very important for second prop MBBS. Okay. Okay, first hydroxyurea and then histone deacetylase inhibitors. I am telling you these two groups are not important. Hydroxyurea. Mechanism of action is very tough. If possible, try to remember. Hydroxyurea inhibit this enzyme RDR, ribonucleotide diphosphate reductase. Ultimately, when hydroxyurea inhibits this enzyme, which further inhibits conversion of ribonucleotide to deoxyribonucleotide, which is the rate limiting step of DNA synthesis. So hydroxyurea blocks rate limiting step of DNA synthesis. This is tough, and my opinion or my suggestion is don't try to remember this, but uses of hydroxyurea is important. SPE special. Okay. S for sickle cell anemia, P for polycythemia vera, you know these conditions. E for essential thrombocythemia. E for essential thrombocythemia, you don't know this. Essential thrombocythemia is one cancerous condition where increased platelet production occurs from megakaryocytes in bone marrow. This is called essential thrombocythemia. And another condition, another leukemic condition, you know, CML. Okay. So these in these four conditions, hydroxyurea is drug of choice. After hydroxyurea, next group is histone deacetylase inhibitor. Histone deacetylase inhibitor. Simply these drugs, here you can see the name of the drugs. Vorinostat, romidepsin, but my suggestion is don't read these examples. These are very tough. Okay. Simply histone deacetylase inhibitor. These drugs inhibit histone deacetylase inhibitor. This histone deacetylase enzyme, which inhibits DNA rewinding from separate DNA strands to DNA rewinding. This is inhibited. Actually, histone deacetylase enzyme helps this, and these drugs inhibit this enzyme and used in T-cell lymphoma. Again, I am telling you, forget about this. This is very tough. Histone deacetylase inhibitors. Don't read this. If possible, try to remember indications of sickle cell and hydroxyurea, but don't read histone deacetylase inhibitors. Okay. Next group. Look here. I was discussing SP-specific drugs. I have finished antimetabolites, hydroxyurea, histone deacetylase inhibitors. Now I will discuss topoisomerase inhibitors. This is one enzyme, you have heard the name. Topoisomerase. There are two types of enzyme, topoisomerase 1 and topoisomerase 2. Okay. So topo 1 inhibitors. Topo 1 inhibitors. Here is the name in the class. Topo 1 inhibitors. Topo for topotecan, I for irinotecan. Topo 1 inhibitors example topotecan, irinotecan. Okay, and topo 2 inhibitors, you have to remember these names. Easy name: etoposide, teniposide. Clear? Now first, topo isomerase 1 inhibitors. Topo for topotecan, I for irinotecan. These two drugs. What is the mechanism of action? Simple. These drugs inhibit topoisomerase 1 enzyme. By inhibiting topoisomerase 1 enzyme, they inhibit religation step or resealing step. Resealing step. Here sealing is required. Okay, but by inhibiting topoisomerase 1 enzyme, these drugs inhibit resealing step, which ultimately results in DNA damage. And important side effects: one is bone marrow suppression, another is diarrhea. Okay, and second is topoisomerase 2 inhibitors. Topoisomerase 2 inhibitors. Example: etoposide, teniposide. Okay, etoposide, teniposide. What is the mechanism of action? They inhibit topoisomerase 2 enzyme. These drugs combines with topoisomerase 2 enzyme, etoposide or teniposide, combined with topoisomerase 2 enzyme and form. Suppose etoposide binds to topoisomerase 2 enzyme, so they form this complex. Etoposide topoisomerase 2 complex, and this complex cause DNA strand breakage. Simply remember these lines, nothing more than that. Okay, topoisomerase 1 and topoisomerase 2. So I have finished S-phase specific drugs: antimetabolites, hydroxyurea, histone desalination, topoisomerase 2. All these covered. Now I will discuss M-phase specific drugs. M-phase specific drugs. First, see the classification. Eribulin, number 1. Number 2, estramustine. Number 3, ipothylones. Number 4, taxanes. Number 5, vinca alkaloids. Okay, so these are M-phase specific drugs, and my suggestion is don't read these drugs 1, 2, 3. Forget about this. M-phase specific drugs, only remember two classes: taxanes and vinca alkaloids. These two classes are important for your MBBS examination. Okay. Okay. Now the examples of taxanes, very important: paclitaxel, and docetaxel. These are examples of taxanes. And vinca alkaloids, example is vincristine and vinblastine. These are very easy drugs: taxanes, paclitaxel, docetaxel, and vinca alkaloids, vincristine, vinblastine. Now, mechanism of action of these drugs are very important. First, taxanes. Both these drugs, taxanes and vinca alkaloids, both these drugs bind to beta tubulin. When taxanes bind to beta tubulin, they increase polymerization of beta tubulin. Increase polymerization of beta tubulin, resulting in stabilization of microtubule. Stabilization of microtubule. So they bind to beta tubulin, increase polymerization, stabilization of beta tubule, and resulting in formation of abnormal microtubules and resulting in inhibition of mitosis. Formation of abnormal microtubule resulting in inhibition of mitosis. This is the mechanism of action of taxane. Okay. Taxane and vinca both bind to beta tubulin. Taxane causes increased polymerization and vinca causes block microtubule polymerization. These are vinca alkaloids. They also bind to beta tubulin, but they block microtubule polymerization. Okay, resulting in metaphase arrest, that is inhibition of mitosis. So taxane binds to beta tubulin, vinca both binds to beta tubulin. Taxane causes increase polymerization and vinca causes blocking of polymerization. Ultimate result is inhibition of mitosis. These are the mechanism of actions. Okay. So till now I have finished cell cycle specific drugs. Cell cycle specific drugs, and before that non cell cycle non-specific drugs. Okay, cell cycle specific drugs and cell cycle non-specific drugs. These are two major classifications of anti-cancer drugs, and apart from this I don't want to take any risk. There are two also other classification. There are other anti-cancer drugs also. Now I am showing this. This is anti-cancer drug number 3. First, focus on anti-cancer drug number 4. These all are hormonal drugs, and all these drugs are discussed in hormone chapter. Glucocorticoids, selective estrogen receptor modulators, aromatase inhibitors, 5-alpha reductase inhibitors, progestins, GnRH analogs, anti-androgens, selective estrogen receptor downregulator, estrogens. All these anti-cancer drugs, all these drugs are used to treat different cancerous condition related to hormone. I am not discussing here because this will be cumbersome. And this is number 4, right? And here is also another classification, number 3. Total classification of anti-cancer drugs are 4. Number 1, non-cell cycle specific. Number 2, cell cycle specific. Number 3, hormonal drugs. And number 4, targeted drugs. These drugs target specific compound. For example, this drug target imatinib. This drug targets tyrosine kinase. Okay. Epidermal growth factor receptor. These drugs target epidermal growth factor receptor. These drugs target angiogenesis. This drug targets proteasome, and this drug targets monoclonal antibody CD20. So you have to remember at least this classification of anti-cancer drugs, hormonal classification and targeted drugs. And again, I want to tell you one thing, that in previous year there were many uncommon questions. So my suggestion is at least be prepared to face this question: targeted therapy of anti-cancer drugs for theory paper. Okay, so I have taken targeted drugs for cancer. I have taken this picture from Sandbach. Here, 1, 2, 3, 4, 5. 5 classifications are there: 1, 2, 3, 4, 5. Simple classification, examples, indications, and adverse effects. I am not discussing because this is very tough, but in extreme adverse situation, this question may come: targeted drugs for anti-cancer. Sorry, targeted drugs for cancer. So my suggestion is take this screenshot and be ready for theory paper. So for theory paper, most important questions are cyclo sorry most important questions for your theory paper is cyclophosphamide short note, methotrexate short note, classification of anti-cancer drug, this is very important, and there are few other questions: explain why. I will provide you in form of PDF, explain why, but these questions are very tough. Okay, so first finish easy questions. So try to remember, first of all my suggestion is try to remember the classification: cell cycle non-specific drugs, cell cycle specific drugs, at least these two, apart from this hormonal and specific targeted drugs. Okay, so I will provide you few MCQs and short notes via PDF, and I know this is really a boring class, but what to do? This is, I have to finish minimum this, I have to discuss minimum these topics. Okay, thank you and take care.